I remember that day very well. And then our nanny came, said there's something odd with his eye. I said, oh, it's probably nothing. And then we went to check it out. And then he was watching TV and his eye was turned inside. And we said, that's very unusual. So that was the first sign there was something going on with Alex. And then we decided to seek medical assistance.
It took us 1 year to understand what was really happening to Alexander, because he's had a very rare form of strabism that usually shows up as a usual strabism, but then we learned that it was rotational, that his eye was going inside every 24 hours. Then we learned that there is not so many doctors in the world who have experience of treating such a rare case. But we were in Cleveland with our doctors throughout all our journey of the diagnosis. Oh, we were very stressed.
It was enormous.
Enormous, yes, because first you see how your child is suffering and struggling on an everyday basis. He had to use glasses. So then this problem affected his mood, his level of tiredness. It was a big struggle, yes?
Yeah, and then we start noticing other kids making comments. He's very young, he's 5 now, but when he started, he was late, 2 years, almost 3. And then other kids, oh, what's wrong with your eye? And mentioning, he would be noticing. And then, of course, that would affect his confidence. And that was a big problem.
Then we realized that we had to find solution as fast as possible.
Yeah, and trying to deny the possibility of a surgery. But the doctor assisting us here, Dr. Malem, was very clear from the moment he diagnosed and to the moment that we understood that that was a need.
1 week after the surgery, he just sat on a bicycle and started riding it without us explaining how to do, what to do. So we realized that disease had such a big impact, even on his physical abilities, yes.
Alexander had a very rare form of strabismus, where maybe 1 to 2 cases are seen for every 1 million people. This means that for most pediatric or strabismus surgeons, they may never see a case in the whole career. So now, like most conditions which are rare, but with careful analysis of his eye motility, which also included our orthoptic specialists, we could accurately diagnose the nature of his strabismus and offer him an appropriate surgical plan. I performed a small surgical procedure on Alexander's eyes, and I'm pleased to say he's done extremely well. His eyes are now constantly and perfectly aligned.